Mental health is a topic that is difficult to talk about and is generally shied away from in the media today because it can raise up some controversies based on someone's opinions. I would like to speak about my opinion on how communication should be handled with someone who has a mental health problem. First, I will go over some of the probably more common opinions on this issue. First, we have J.K. Murphy, a journalist for Healthline, who I almost disagree with entirely. She states that from personal experiences, there should be no communication except professionally when you have a mental health problem. And I do feel bad for her because in her article she spoke about having bad experiences, like people being arrogant or unaware of the situation entirely, and that kind of closed her off. She said that intent is irrelevant and the results are. So in a way, she is saying that it doesn't matter how you approach something, it's how someone feels in the end. However, I would say, while that is somewhat true, further communication can also help with that process. Now, Dr. Timothy Legg and Dr. Jennifer Casarea from Medical News Today and WebMD, respectively, would say that communication is okay in a family sense or with people you trust and respect, but the main thing you should be worried about, and really the only thing you should be worried about, is making sure you go to see a medical professional. In Casarea's article, she states that a mental health problem can be a result of an underlying physical problem. So if you do have a mental health problem, one of the best things you can do is go to a doctor, and I fully agree with that. Because if it is because of a underlying health issue and not just a mental health issue, then that could help put a stop to it. But neither one of them suggests that any further communication should be done from a mental health standpoint. Now, the final argument that I will go over, and that I really agree with for the most part, is from Dr. Sally Ann Cooper and Chris Hatton, who both worked on an NCIB article entitled Identification and Assessment of Mental Health Problems, where they say that communication within family and loved ones is imperative to the identification and assessment of a mental health problem. And I agree with that fully. However, I would like to expand on that and say that broad communication and keeping on communication after you have had a mental health problem addressed is very important for the healing process. So my first point is that communication helps in identification of mental health problems. And this goes along the lines of what Dr. Cooper and Hatton were saying, that how someone can communicate can kind of give you an idea of what might be going on in their mind. If someone is solemn or very quiet when normally they are very upbeat and loud, that can be a sign of something major bugging them. It also allows for explanation from somebody who has a mental health problem. If you were to, say, communicate with a friend or family member who had a mental health problem and they were okay with communicating that with you, then it could further let them explain maybe what's going on and could help with the identification of their mental health problem. I would argue that communication is the first step in the healing process for someone with mental health problems. A lot of times, mental health issues can branch off from a pent-up negative emotions. So allowing those to flow out to a neutral or trustworthy source can really allow for some of that weight to be lifted off of someone's shoulders. And although it may not fix the problem entirely, it can provide immediate relief to their issue. Another thing is that when someone with a mental health problem decides they want to communicate with you, that means that they trust you and will understand that they have something going on that isn't right and that they are in pain. Finally, we have communication as a support system. There are many support groups for people with mental health problems, whether it's at a library, a church, if that is applicable, or even a college campus. There are people there who have similar experiences to someone with mental health problems, and they can all relate to each other and help them out through their issues. It also shows that people will love and support someone with mental health problems no matter what they are going through, no matter what hardships they have, because a lot of times people with mental health problems, especially depression, feel like they are alone, that nobody will understand them or loves them, and communication can help break that barrier.